I'm going to be demonstrating 3 orthopedic tests you can do for the low back and thigh region. The first one is the straight leg test, and you would do this if the patient complains of low back pain or posterior thigh. And the point is to differentiate between hypertonicity in the hamstrings or impingement of the sciatic nerve. So you have the patient lay down on their back, and the first thing you would do is hold the patient at the calcaneus, and you flex their leg until you start feeling a restrictive barrier. And at this point, the patient might feel radiating pain down their leg. And if that's the case, you lower the leg slightly until the pain goes away, and you dorsiflex the foot and see if you can recreate that pain. If you can recreate the pain by dorsiflexing the foot, that is sciatic impingement. And if it doesn't get recreated, then it's hypertonicity in the hamstrings. The next orthopedic test we're going to do is the Patrick's or FABER's test. FABER is actually an acronym for flexion, abduction, and external rotation. So you flex the patient's thigh, you abduct, and you externally rotate. And you put their foot on their knee. And you would do this because sometimes patients come in and they say they have hip pain, but they can't differentiate between back pain in the sacroiliac joint or hip pain in the hip joint. So once you have them in this position, you ask them if this alone is painful. If it's not, one thing you could do is stabilize the ASIS and push down on the knee like this. If there's pain in the back, it's the sacroiliac joint, and if there's pain in the hip or anteriorly, it's the hip joint. The next test we can do is the Ober test. And this is if the patient is complaining of lateral thigh pain or knee pain. And this is really common in runners. So what you can, and this would be hypertonicity in the iliotibial tract. So you have the patient roll on their side with their back facing you, and they're going to slightly flex at the hip and the knee. And then you would take the knee in question that's painful for them, and you would extend it and allow it to drop down. If it can't drop to the level of the table or below, then that's a positive sign of hypertonicity in the iliotibial tract.